Hi there again everyone, this is Vince Gerald M. San Miguel, a first-year nursing student from Nueva Ecija University of Science and Technology. And this is the continuation of assessing the vital signs, which is the assessing the blood pressure. So, let's go! For the assessment for this procedure, first we must assess the signs and symptoms of hypertension and hypotension. Also, we must assess the factors that may affect client's blood pressure. Also, we must determine the policies and procedure for the facility. And lastly, we must determine the client's medication record that may increase or decrease client's blood pressure. For the planning for these procedures, we must assemble the equipments and supplies that we will need in these procedures. The equipments and supplies that we will need in these procedures are first, the stethoscope, next, the blood pressure cuff, and the sphygmomanometer, and lastly, alcoholized cotton swabs. For the implementation, the first step is to give. Greet the client, introduce yourself, verify the client, and explain to the client kung ano nga ba gagawin natin. The rationale behind this is para malaman ng client kung paano sila makapag-participate sa procedure na gagawin natin. Good day po, ma'am. Ako po muli si Vince Gerald M. San Miguel, student nurse po from Nueva Ecija University of Science and Technology. And today po, magpa-perform lang po kasi ng vital signs which is the blood pressure. Ano po yung pangalan po, ma'am?
Ako si Kira Cantigel.
Ilang taon po kayo?
45.
45? Okay po. Next step is the perform hand hygiene or hand wash. The rationale behind this is to prevent the cross-contamination that may happen. Next step is the close the door, close the curtain. The rationale behind this is to provide privacy for the client. Next step is place your client in appropriate position, wherein for adult client it should be in a sitting position, wherein the both feet of the client should be flat on floor. The rationale behind this is para po makuha po natin yung exact na gait po ng pasyente po natin. And the elbow should be slightly flexed, wherein the palm is facing up and the forearm supported at the heart level. And then expose the arm of the client. Ma'am, tataas ko lang mo po itong ano. Tataas ko lang po. Next step, rough the deflated cuff evenly around the upper arm. Then locate for the brachial artery of the client. Then, the border of the cuff, it should be 2.5 or 1 inch or 2 finger above in the antecubital space of the client. Ilalagay ko lang po. Then perform a preliminary palpatory for determination of systolic pressure of the client.
For the pulmonary palpatory, palpate the bronchial artery with the fingertips. Close the valve of the pump by turning the knob clockwise. Pump the cuff until you no longer felt the bronchial pulse. At the pressure, the blood cannot flow through the artery. Note the pressure of the sphygmomanometer at which pulse is no longer felt. Release the pressure completely in the cuff and wait for 1 to 2 minutes before making further measurements.
After you perform a preliminary palpatory, next step is position your stethoscope appropriately, but before that, we cleansen the earpiece of the stethoscope with alcoholized alcohol.
Insert the ear attachment of the stethoscope in your ear so that they tilt slightly forward. Ensure that the stethoscope hangs firmly from the ears to the diaphragm. Place the bell side of the amplifier of the stethoscope over the bronchial pulse. Hold the diaphragm with the thumb and index finger. The rationale behind why we use the bell is to hear clearly the pulse of the patient.
Then, auscultate the client's blood pressure.
Pump up the cuff until the sphygmomanometer reads 30 millimeters of mercury above the point where the bronchial pulse disappeared. Then, release the valve of the cuff carefully so that the pressure decreases at the rate of 2 to 3 millimeters of mercury per second. As the pressure falls, identify the manometer reading, deflate the cup rapidly and completely. And when the device has determined the blood pressure reading, note the digital results.
Then, remove the cap. Then, wipe the cup with approved disinfectant. For the evaluation and documentation in this procedure, first we must document the blood pressure of the client in vital sign record sheet. Next, report for abnormal result. And lastly, document the procedures in client's record. Again, this is Vince Gerald M. San Miguel, a student nurse from Nueva Ecija University of Science and Technology. Thanks for watching.